In this video, I'm going to show you 10 reasons why you're having pregnancy symptoms yet negative test results. 1. You may be pregnant, but you bought a faulty pregnancy test kit or cassettes. So maybe you bought an expired product or damaged product from the store, or the test strip was exposed to either high or low temperature. It's very possible for a pregnancy test kit or cassettes to malfunction. So if this is the case, then try buying another test kit or cassette from a different store and retest. 2. You are pregnant, but you misused the test strip or cassette. If you didn't follow the instruction written on the leaflet, or you didn't drop the wheel on the right part of the testing strip, and you didn't keep the strip lying flat and face up, it could be the reason why you're having negative results. 3. You are pregnant, but the level of the pregnancy hormones are very low for the test. If you're newly pregnant, the hormone called the human chorionic gonadotropin, HCG, which is produced by a growing placenta, might still be very low, especially when your wee is diluted, maybe after taking much water or fluid. So if you want to get accurate results, find a particular time of the day to do your testing. You may avoid drinking at least 1 to 2 hours before testing, or better still, test early in the morning. 4. You are pregnant, but you are testing too early. If you test too far away from your expected period date, your pregnancy hormone level may not be enough to make your results to be positive. So just wait a few days until you're past your next period date. 5. You are pregnant, but you are overly hydrated. If you took a lot of water before testing, of course, the HCG level will not be enough and you are less likely to get a positive test result. So reduce intake of water at least 1 hour before you take the test. The 6th reason why you're having pregnancy symptoms yet negative test result is that you're not pregnant and you're about to see your menstrual period. Increased levels of progesterone may cause you to have symptoms that looks like pregnancy, like nausea, vomiting, loss of appetite, fatigue, mild cramping, and others. So in this case, give yourself a few days and check if it's actually menstrual period. If it's your period, you will know, and if it's pregnancy, of course you will still know by the time you take your next pregnancy test. 7. You're not pregnant, rather you are ovulating. Most times during ovulation, a woman might develop symptoms that looks like pregnancy. The 8th reason why you're having pregnancy symptoms yet negative test results is that you're not pregnant. You are having psychosomatic symptoms. When a woman is eager to have a baby, sometimes the desire to have a baby might be so intense that her brain can't think any other thing except pregnancy. 9. Side effects of some fertility drugs. Some fertility drugs can increase progesterone or block estrogen, and this can cause symptoms that looks like pregnancy, such as mood swings, bloating, morning sickness, and others. 10. If you've had early miscarriage. If you feel pregnant but negative test results, you may have had a very early miscarriage, also known as chemical pregnancy. Here, when there's a problem with the fertilized egg, most especially chromosomal disorder, it makes the pregnancy non-viable. Once the body detects it, it will spontaneously remove the baby. Symptoms of pregnancy may develop as hormones are steadily released into the system. If your pregnancy symptoms continue and your tests are still showing negative, then talk to your doctor. And if you're trying to conceive, see a gynecologist or a fertility doctor for checkup.